Hello everyone, Vicky from BioMonde here, and I'm just hopping on to answer another one of your questions. And today that question is, can maggots be used with blood thinning medication? So if your patient is on something like warfarin or similar, then it is worth checking their clotting factors before starting maggot therapy. If their clotting factors are within therapeutic range, then it's absolutely fine to use maggot therapy. If they are out of range, then it might be worth considering waiting a while or different options, or you can discuss with the team the risks versus the benefits of having it now. Reason being, maggot therapy does promote angiogenesis, which is the creation of new blood vessels, and that can lead to a little bit of light bleeding towards the end of the therapy. And obviously if your patient is on blood thinning medication, then they're more likely to bleed a little bit more.